Malawi's HIV prevalence is one of the highest in the world. With 10.3% of the population living with HIV, it accounts for 4% of the total number of people living with HIV in sub-Saharan Africa. In response to this HIV epidemic, the United States Agency for International Development, USAID, launched the One Community project in December 2015. Implemented by the Johns Hopkins Center for Communication Programs, CCP, in collaboration with Project Hope and Plan International, One Community aims to mitigate the impact of HIV and prevent new infections in Malawi. One Community will do this by increasing the utilization of high-quality HIV care and support services, increasing the adoption of HIV prevention and control behaviors, and strengthening the capacity of local partners to implement HIV prevention, care, and support programs.
So first of all, I should say that One Community is a PEPFAR-funded program through USAID Malawi. It is a cooperative agreement, and the project was awarded to Johns Hopkins Center for Communication Programs as the lead implementer. And we have a Plan International and Project Hope as sub-partners on this project. The program works with the beneficiaries, which are orphans and vulnerable children and their households. Also focuses on people living with HIV, these are adults, as well as young people living with HIV, adolescent girls and young women.
HIV prevalence in the southern part of Malawi is twice as high as prevalence in the north. Accordingly, One Community's efforts are focused in the south, targeting some of the districts with the highest HIV prevalence: Blantyre, Balaka, Chikwawa, Machinga, Mangochi, Mulanje, Palombe, and Zomba. One Community's overarching approach is combination prevention. Within this approach, One Community implements 3 key interventions that contribute to Malawi's 90-90-90 targets. Social and behavior change interventions to increase the uptake of HIV prevention and control behaviors and social norms. Biomedical interventions to provide community members with high-quality HIV care and support programs and related services. Structural interventions to provide an enabling environment for community members to thrive.
Within the One Community project, social and behavioral change communications plays a vital role in contributing to the 3 key objectives of the One Community project. These 3 objectives include, if I can simplify them, include getting lots and lots of people to know their HIV status. That means getting people to go for the HIV test. 2, once people get tested, those that test positive need to be on treatment. So the second objective is to get the majority of people, or everybody who tests positive, to get HIV treatment. Now, getting HIV treatment is one thing. Adhering to this treatment to get the desired results is another thing. So the third objective is to get people who test positive to suppress their viral load to the point where they lead normal lives and are not able to transmit HIV.
90-90-90 is an ambitious strategy designed to help end the AIDS epidemic by 2020. It simply means that 90% of all people who have HIV know their status. 90% of all those who know they have HIV receive sustained antiretroviral therapy, and finally, 90% of all people receiving antiretroviral therapy have viral suppression.
So if you take about the first 90, it's all about testing, knowing the HIV status. So in that regard, we create a targeted kind of demand among our priority populations. And once we created the demand, we will stratify their risk, whether they are eligible for testing or not, because our goal is not just to test everybody. Our goal is to have a targeted HIV testing so that we can get the maximum benefit from the resources we spend.
With an estimated 530,000 orphans in Malawi as a result of AIDS, supporting the needs of orphans and other children made vulnerable by AIDS, OVCs, is a main component of the Malawi HIV response. Through its community and household assessments, One Community has identified and profiled the most vulnerable households in its focal catchment areas. One Community will work with other partners to provide support to OVCs and their caregivers in the areas of child education, child protection, legal protection, early childhood development, child health and nutrition, economic strengthening, and psychosocial support. One Community's OVC component extends into the DREAMS initiative that is currently implemented in the Zomba and Machinga districts. DREAMS means determined, resilient, empowered, AIDS-free, mentored, and safe girls and young women. One Community has identified and recruited 11,000 very vulnerable adolescent girls and young women who are out of school, either married or unmarried. These girls will be formed into clubs called Go Girls Clubs. Through the Go Girls platform, One Community will reach out to vulnerable girls and young women with the following services: gender-based violence and HIV prevention, social asset building, parenting education and support, caregiver skills building, household and youth economic capacity strengthening, and youth-friendly reproductive health services. To pull it all together into one functioning whole, coordination and collaboration with other implementing organizations and government is crucial.
We also work with USAID funded partners, so in each of the districts there are other partners that are already working. So we make sure that we are working in synergy and we are not duplicating what we are doing. So we make sure that in all the districts with all our USAID funded partners, there are no duplications. Where we are overlapping, then we discuss and make sure that we are maximizing on the coverage. One Community focuses on establishing referrals and linkages, and so we have to make sure that we are in good collaboration and really identify who are the other players on the ground.
To stay on track and deliver on the project goals, One Community will need an efficient monitoring and evaluation system that encompasses seamless referrals between various services.
We're using a developer to develop a system for tracking our referrals through a digital system. So our community resource persons in the community will be doing case assessment, and then any referrals that they make will be brought to the community engagement facilitator. Those referrals will be entered into a tablet, which will automatically show up on the tablet of the recruitment and linkage facilitator who is based within the health facility. So that will allow for real-time tracking of the referrals that are being made from the community to the facility, as well as from the facility back to the community.
It is important to note that One Community's efforts are an extension of government's efforts at providing good health for Malawians.
Zomba District Health Office looks after a population of about 800,000 people, and we do this in partnership with various organizations. As the District Health Office, our primary role is to provide primary health care services, which is preventive health. So most of such activities are done in the communities. But due to lack of resources, most of the times we don't manage to cover the communities as much as we would love to be. So we are slowly getting confined to the facilities.
In 2016, One Community started implementation in 37 high-volume health facility catchment areas. One of the first activities to be implemented was the training of community leaders. One Community trained 58 traditional authorities and 77 faith-based leaders during a 2-day workshop. The training focused on establishing the link between gender norms, cultural practices, and the spread of HIV, as well as on what community leaders can do to halt the spread of HIV in their communities. The training also helped to increase the acceptance and ownership of One Community by the focal communities.
We are happy that One Community project is there for the next 5 years. We feel it will have a lot of good impact in a way that information regarding HIV/AIDS will be brought to their, to their steps, because I understand that one community will be working closely to the grassroots, to the people, because a lot of people, either they fear to go to the hospitals, or sometimes because of distance and the economic factor also.
One community tagwana ushito yotamandika kwambiri imene inatipasa chido kwambiri kwakuti anthu ena amene anali ndi manyazi pofuna kuwulula matenda HIV awo atatiphunzitsa at least anthu akumasuka.
In order to deliver all these services and implement their activities, One Community has recruited community-level health workers. Community engagement facilitators are One Community staff members who will oversee the implementation at the community level. Community resource persons are volunteers who will work within the homes and conduct case management, as well as implement small group sessions. Recruitment and linkage facilitators are volunteers who will be based in health facilities in order to facilitate recruitment into the program, as well as help referred clients to access the services that they need. Additionally, One Community has trained 205 community engagement facilitators and 2,040 community resource persons. These community health workers are One Community's backbone, and the implementation of all its activities rests on them.
Masomphenya mwanga ndikuona ngati kuti idzafika nthawi imene even mankhwala ARV acha mabunga maiko amene amatithandiza akhoza kupeza kuti atopa. Ndiye ngati anthu akupitiriza mchiridwe wogonana mosadzachiteteza kumatengabeka chilombo. Zionetse zone kuti chiwerengero cha kachilombo chizifala. Anthu amene azifuna mankhwala achuluka. Ndiye kuti nduna wathu za umoyo sudzakwanitsa chiwerengero chimenecho kuchipatsa mankhwala chifukwa tidzakhala kuti dziko la Malawi lidzimira palokha kuti ligule mankhwala othandiza ndani anthu aja. So uthenga wanga ndionera kuti HIV ilipo ndipo nthawi zonse anthu akutenga. Nditi tiziteteze ku matenda amenewa.
Supervised by CEFs, one cadre of CRPs will conduct house-to-house visits, profiling household members, determining their health and socio-economic needs, and linking them to the appropriate services. Another cadre of CRPs will conduct community HIV prevention outreaches through small group discussions and community action sessions, and link participants to HIV testing and related services, including voluntary medical male circumcision, VMMC, prevention of mother-to-child transmission of HIV, PMTCT, and antiretroviral therapy.
We want to see a Malawian village that has vulnerable children, adolescents and their families that are well linked to health services, and that they are resilient enough to support their well-being, and that they are adopted behaviors that are helping to prevent HIV, as well as to mitigate the impact of HIV.
One Community's approaches and processes, coupled with the passion of trained community health workers and the resilience of community members, will ensure that households in focal communities receive the highest quality of HIV and AIDS prevention and impact mitigation services, and are provided with an environment in which they can thrive. As the name implies, One Community is truly Malawi's flagship community response to the HIV and AIDS epidemic.